This Week in Virology, the podcast about viruses, the kind that make you sick. This Week in Virology, episode number 309, recorded on October 31st, 2014. Hi, everybody. I'm Vincent Racaniello, and on this Halloween day, you are listening to TWiV, the podcast all about viruses. Well, it's actually about one virus.
The podcast about virus.
Joining me today here in the studio, Dickson Despommier.
Hello, Vincent.
It's nice to see you, Dickson.
Well, I feel at home again.
Where have you been? You've been away?
Yeah, I've been to Vienna and to Lisbon and to Utah and to Wyoming.
Good. Well,
now
here,
I'm back.
Here we are. We're going to talk about viruses today, okay?
Sure.
Also joining us today from Western Massachusetts, Alan Dove.
Good to be here.
How have you been?
I'm doing okay. The weather's kind of clouding over now, and kind of.
Oh yeah, look at it. It's cloudy. Not very nice.
Overcast, around
Autumnal.
5,500 feet. Visibility is still good, but
Cloudy and 12 Celsius. You know, I was out in San Diego last weekend. Man, it was nice.
Oh, it's always.
I
nice
understand
out there.
why people like to live there,
It's the same though every day.
but I don't want to live there. Of course, I'm sure they don't want me living there either, so that's fine. Also joining us today from southeastern Michigan, Kathy
Hi, everybody.
Spindler.
Happy Halloween.
Hello, Kathy.
happy Halloween.
Indeed.
What virus are you today?
I don't know. I'm wearing a black and white and gray, whatever that virus is.
the black and white and gray one. And joining us after a long absence,
Hiatus.
from North Central Florida, Rich Condit.
Hi, everybody.
Hey,
How
Rick.
you doing?
Hello,
Hey,
Rich.
welcome back,
Oh,
Cotter.
boy, is it good to be back. This is good. This is great. It's 73 degrees, clear blue sky, 45% humidity, dew point 51.
Wow.
And that's, by the way, that's, I guess, 73 is what, 27? Did I look it up? Celsius? Does that make sense?
Comfortable. Beautiful.
Sounds about right.
At any rate,
You're
nice
substantially warmer and sunnier than up
yeah,
here.
well, this is Halloween in Florida.
Well, we're
We-
getting to the point of the year where Rich's weather report starts to get very annoying.
Exactly.
Our weather is
Exactly.
42 degrees, kind of drizzly. They were even talking about snow for the trick-or-treaters, although that's
Ooh,
maybe
dear.
changed right now.
Oh, dear.
Yeah, I remember in Buffalo, my kids used to, spend weeks getting ready for Halloween and all dressed up, and then they'd put on these big coats and go out trick-or-treating.
Exactly.
Here in New York City, the costume of choice is a biohazard costume, of course.
Yeah.
Of course.
But I would think someone should dress up as a filovirus. That would be even cooler, right?
Yeah.
No,
I
they'd be
bet there'll be some
quarantined
of
for
those.
21 days. They would never be allowed to trick or treat.
You'd probably freak people out if you showed up as a filamentous particle with glycoproteins.
If they could figure it out.
Exactly.
Exactly. Well, here on TWiV 309, the current Ebola case number in Western Africa is 13,703 with 4,900 deaths. And the last time we recorded on 307, it was 8,900 and 5,000. So the case count has gone up substantially, and the fatality numbers have gone down.
Right.
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 This
They're
has
learning.
something to do with their accounting, among other things.
Improved
You recall a
data
footnote.
collection, yes.
Yeah, but there is an improvement in healthcare systems in some parts of Liberia, for instance, where they have actually adjusted to the outbreak.
Oh, Dickson, the numbers went up.
I heard a story
substantially.
on NPR all about that. It's true.
This episode, by the way, is brought to you by the Department of Microbiology at the Icahn School of Medicine at Mount Sinai. There you can find over 20 virology labs in one building in New York City, right near Fifth Avenue. So if you're interested in pursuing a PhD or a postdoc in virus research, check them out. They have a December 1st deadline for applying to the graduate program, which would start, of course, next year. So you should go to their website at mssm.edu/MIC. And if you are interested in a postdoc, You can go to the website and find the faculty you are interested in and apply to them. Okay, Dickson, you want to do a postdoc?
I could probably use one.
Yeah. Check that out.
It's been a while since I've done a postdoc.
All right, a few words here at the outset. This is going to be an all Ebola episode. Mostly.
No.
There are some,
Yep.
because we have a lot of emails, but you know what?
We have some picks of the week, too, that are different.
We have some
do.
picks. There's some
Stay
emails.
till the end.
They're
Yeah.
actually,
And
so
we
stay.
have one Halloween joke,
But we're going to do something different. Yeah, Dickson has a good Halloween joke. Do you want to start with it?
if you'd like.
Go ahead.
How do ghosts protect themselves from infectious diseases?
How, Dickson?
With immunoglobulins.
I like it.
I like it, actually.
I like it.
I like it. Good job. Dickson, you're on your game today.
Well, that's my only
A
joke.
lot of names. Anyway, we're going to not read every email today. We're going to just get to the real questions. And so, a lot of them are lovely, and we usually like to read everything because you guys put work into it. But we want to get through these because this will be the last all Ebola for some time, I think.
Yeah. So if you wrote a wonderful letter about how you started listening to TWiV and told us an excellent story about that and the weather report that we usually expect, that's wonderful, and we love you for it. But we'll probably just read the main question that you asked.
Yeah, because we got like 43 pages of this.
Yeah.
Will we still have stuff in the show notes, though?
Yes, so I wanted to mention, and most people don't really go to the show notes, but at TWiV.tv, each episode has a little show note section, and at the very last part it says letters read, and you can click that and you will go to a page where I put the entire email of everyone's.
How about that?
And I know very few people know about that, but it's all archived for eternity, or at least until I stop paying the bills. Who knows which will come first.
Exactly.
I have to figure out a way to keep the website going after I'm gone. I could pay
You mean like gone?
Yeah, dead.
Don't.
I think you can endow
even-
it somehow.
Yeah, I
We'll
wanna
figure out
find
a
out.
way to do that.
That might be a
Yeah.
while, Vincent.
Yeah.
It could be in a minute. It could be in 20
No.
years. Who
No, no,
knows?
no.
Well, if it's in a minute, you could just kiss the website goodbye. No,
I
not
suggest we have best of for the next 200 years.
Anyway, so that's today. And but right at the front here, of course, every week something happens. So
This is
last Friday, I was flying out to California. And of course, the night before, there had been this case, the first case of Ebola virus infection in New York City. And this was an emergency room physician who works here at Columbia. He had been volunteering in Western Africa, came back and was hanging around here for a while. And then one morning woke up with a temperature, and he was diagnosed with Ebola virus infection. He's now at Bellevue Hospital, which has been determined to be the hospital where the Ebola infections are going to be treated.
Any news on how he's doing?
I read today that he's in serious but stable condition.
The case fatality rate, although we're talking about small numbers, seems to be lower here
In the U.S.
Yes.
Only
Fine.
one so far.
Yes.
Two.
Two?
Well, the guy in Dallas, and
yeah.
was there not another one?
No.
No.
That's
One.
it.
Okay.
So the interest with the case in New York, of course, this fellow went around the city. He went bowling in Brooklyn, he went to see his girlfriend, and everyone's all up in arms that he was walking around. And this is something that'll come up multiple times today, but this quarantine period when you're incubating infection, you have virus in you, but apparently not at levels enough to transmit.
Right.
Because there's no risk factor in all the previous outbreaks, and we'll get to a really nice CDC article that summarizes this. The risk factors are contact with bushmeat, infected patients, burying infected corpses, and so forth. Not casual contact, not being in a room with someone who 3 weeks later got Ebola. There's no example of that being a risk factor.
Even the one who died, his girlfriend didn't catch it.
Yeah, I think the Dallas patient is one of the best sort of anecdotal examples because he was walking around sick for 4 days.
He was
walking around symptomatic for 4 days, and he was actually vomiting before he went to the hospital, right? And he was in close contact with a lot of people, and they're fine.
Yep.
Right, and I think almost everybody, when they first heard that some healthcare worker in Dallas had come down ill, assumed that it was going to be one of those ones when he was first there, not 2 days later or whenever it was that, and none of those people that saw him the first time he came in, when he first had some symptoms.
Right.
That's
So
So as we talk today, there's been an issue in Maine, right? There was a nurse who had been quarantined, and she was objecting to it, and I guess she even went out and took a bike ride. And now the judge today just now said you can go out. And so the quarantine issue is really a political issue in part because the science says that you don't need to quarantine. I think the healthcare workers coming back should just be monitored on a daily basis. You call in and tell us how's your temperature, how you're feeling.
Yeah. You know, of the people,
that's what CDC recommends.
Which,
of
yes,
the people
by the way,
who
is the CDC guideline.
Mm-hmm. Yeah, so of the people who have overridden the CDC guidelines to make more stringent requirements,
you mean the states, right?
Yes. Of those people, the governors in particular, which one of them has a PhD in virology? I'd like to know that. And which one has a PhD in
epidemiology,
emergency medicine, or none
public
of them?
health? Yeah.
Public health.
Public health, none of them. And so, in fact, one of them happens to have risen, at least in the eyes of the Republican Party, to the level of potential presidential candidate. And I can guarantee you that this is going to come back to haunt him.
Are you talking about the governor of New Jersey?
I might be. I'm afraid to say his name because I live in New Jersey. I don't want to get
he's not going to come after you. Don't worry. So CDC has a very nice page about guidance for monitoring and movement of persons with potential exposure. So all the guidelines are there. Yes. And, of course, states choose to do as they wish. But New York was asked by the White House not to quarantine some people, right? Or was it New Jersey? I don't remember. Anyway, it's a hotbed thing.
Well, and in addition to the science, the infectious disease science being very clear, the social science is actually really clear on this too. That quarantines don't work.
Exactly.
And we have the most recent really big example of this is probably SARS.
Right.
Where a number of countries, Taiwan was particularly notable in this regard. They tried to quarantine lots and lots of people for exposure to SARS. And it didn't work, and it was virtually unenforceable. The people most likely to skip out of the quarantine were, in fact, healthcare workers.
Sure.
So this is really, really counterproductive.
Hey, Dickson.
Yes?
Where does the word quarantine come from?
I bet you it's a Latin term for something like sequester.
No, it means 40. You know that. You told me this story like 10 years ago on the first TWiV.
I'm not sure I ever talked about quarantining.
No, wait a minute. You were talking about decimate.
That's 10%.
Decimate that's the term you're thinking about.
Well, no, quarantine is an Italian word.
Okay, now you're
and Black Death during that time.
Yeah, well,
Venice built a hospital center, and when sailors from plague-infested ships came, they were sent there for a 40-day waiting period, which was known in Italian as quarantinario. Quarantinario.
It's nice. Thank you for clarifying.
And in fact, they shrunk it to 30 days, and they called it a trentinario, but
we didn't
change the name, so now it's quarantine.
So this 21-day thing people are advocating for Ebola would be, what, a ventivario?
Ventunario. Oh, let's go. Come on. I can do that because I'm Italian.
But I can't because I'm not.
Don't think I'm making fun of Italians. Now, someone pasted in the article about Louisiana restricting attendance at a meeting.
This
What's that
ridiculous.
It's the American Society for Tropical Medicine and Hygiene, at which this kind of work on Ebola and other infectious diseases is commonly discussed.
Correct.
So, they're restricting that, at least as of the article that was in Science two days ago, and I just checked, and I haven't found anything more updated on the web.
Who are they restricting? People who have been to West Africa?
People who've been to West Africa, Liberia, Guinea, or Sierra Leone.
This is ridiculous.
Who might have, really the most to contribute to that meeting in the current circumstances.
Now, Dickson,
that's my society.
Since you're from New Orleans, I'm blaming you for this.
Are you now? No, I'm an expat. I don't go back.
All right. Today I found an interesting proposal from the Defense Threat Reduction Agency. Okay? And this is a part of, part of the U.S. government, right? They issued a proposal called Chemical/Biological Technologies Department Ebola Broad Agency Announcement. Purpose of this announcement is to solicit research proposals for chemical and biological defense program, Defense Threat Reduction Agency requirements for the Ebola. I'm not going to read all these acronyms. It's ridiculous.
Right.
So they have a number of issues here that they want proposals on, and one of them is to figure out if Ebola virus could be transmitted in another way. So when I heard that was summarized somewhere, I said, oh, do they want people to do ferret passage experiments? Gain of function? No, they don't. They want to know like how many virions are in an aerosol that someone coughs out, how stable are they, and so forth. But really the way to address it would be to make Ebola airborne transmissible. Now, I'm not suggesting that anyone do that, but that would be the best way. And, of course, no one will be able to do that because we have a quarantine on gain-of-function experiments. Not only do we have a quarantine on people.
But you're even assuming that it can be done, too, so you don't know if that actually is possible.
We don't know. I bet it could be done. Why not? But you don't know until you try it. You could do it in mice because there is a mouse model. You could try aerosol transmission. There's a non-human primate model, which would be more expensive. But you could pass it. I would say pass it 10 times from macaque to macaque, and then see if it's adapted to aerosol transmission. And then talk about the results to a reporter.
A Fox News reporter, please.
Sorry.
They have a whole attachment. They have megabytes of course,
files.
paperwork
Lots of
associated
stuff
with this thing.
Absolutely. And of course, if you want to work on the virus, you need a BSL-4 facility.
Right. And one of the attachments to it is called DIRC. And I just downloaded it, and sure enough, you have to have your DIRC dual-use research of concern mitigation plan. And, on and on.
Big time. Yeah.
And also, I had sent you a link about NSF is requesting rapid proposals for non-medical, non-clinical care research that can be used immediately to educate about prophylactic behaviors and encourage development of products, processes, and learning that can address this global challenge.
Like, does a podcast fit into that?
Might.
Are we a prophylactic?
Education.
Yeah, educate. Yeah.
All right, let's make a podcast about Ebola.
Bingo.
We have.
We'll get.
Let's make another podcast.
Well, let's make a new one so we can get money from NSF.
That would work.
All right.
We could do that.
We actually have some real follow-up. So last week's episode was with an interview with Tom Solomon, which I had done back in August. And Jackie writes about a condition called autoimmune, anti-NMDA receptor autoimmune encephalitis, which was a condition that he had mentioned. And she mentions the book by Susanna Callahan called Brain on Fire. And she talks about her experience with that disease. And I just want to mention...
It's not her name. Her name is Susanna Callahan.
Callahan, sorry. What did I say, Callahan?
You did.
Dickson, you're actually looking.
I read her name, and I said, that doesn't say Callahan.
All right, so Dickson, you see that insect in glass on my desk there?
Yes, I do.
She gave that to me.
That's a rhinoceros beetle.
Because I read her manuscript a long time ago and made some fixes and stuff.
Like
so if you read her book, you'll find me somewhere in there. She also sends a pick of the week. She says it adds to one of our story arcs. It's a speech by Emma Watson to the UN to kick off the He for She campaign, a campaign meant to end sexism, not just against women, but men as well.
Yeah, I didn't get to watch the video, but I did start to look at what's written up about it on the page, and it looks like one worth watching.
Yeah, cool. I have watched that speech.
So she gave you that beetle. Was that a beginning of insexism?
Jeez, Dickson.
Wow.
No, she just knew I like science, so she came up to thank me, and we actually went to lunch, and she gave me that.
You missed my pun.
But I wrote her an email the other day saying, hey, we got an email about you to TWiV, and she didn't answer me, so I guess I don't count anymore.
Oh, well, she's busy.
She's a reporter for the Daily News. What's the other newspaper in New York here besides? Oh, the Post, right? One of those two. I don't remember which one.
That's right.
Okay. We have an email from Connell.
We do.
Who is a virologist from Belfast and listened to 308. He says he once woke Solomon out of bed about a clinical case. He really liked it. One correction, UK does not currently use oral polio vaccine. It uses the inactivated. They switched in 2004, and that's, of course, the Salk vaccine. And Jonas Salk's 100th birthday was this past Tuesday.
Bingo.
Tom Solomon's TWiV with you was fabulous. I loved him doing Texas accent.
Now, wasn't that great?
People who haven't listened to it, you have to listen to it. First, encephalitis. And then he went into a whole other riff about going into McDonald's that was just hilarious.
He's a funny guy.
Check it out.
And he is the boss of one of our writers who writes a lot, Lance. And Lance had originally said we should get him on. And the last real follow-up is from Brooke, who also has a question about the Solomon episode. So she said that I thought we had to switch from oral to inactivated polio to because the infectious virus is shed in the stool. And she writes, from what you were saying, it seems the inactivated virus also causes live virus to be shed. So no, that's not what we meant. What we meant is in a population immunized with an activated virus, their intestines remain immune, so they can be infected with wild circulating viruses and shed it.
Their intestines remain non-immune.
Right.
Naive.
And this is what's happened in Israel. They have used IPV there, and there is extensive intestinal shedding of wild virus because the intestines are not immune. That's what we meant by that.
So the inactivated vaccine prevents you from getting poliomyelitis, but it does not prevent you from being a carrier.
Right.
Because you have to inject it.
Right.
Not swallow it.
Okay. By the way, we've had lots of good download numbers for the last... All the Ebola episodes have gotten over 10,000 downloads each, which is really good because in the short period of time, usually it takes a few weeks to get up to that place. And I just want to point out that the Solomon is half that much. Yeah. So, we can't...
Give it time.
It may be in time. It's not a great experiment. The Borno was 8,000, so that was like a little bit of Ebola, right? And a lot of Borno. So people clearly want to hear Ebola. There are a few, as you will see later, who don't. But hey, you got a Solomon. Listen to Solomon. He was good.
Mm-hmm.
Right.
All right, now we've got... I tried to organize these things. So these first bunch of emails are about transmission. Maybe Kathy could start out with that
Okay. So Dave writes, I see in the infographic on your site, Ebola does not spread in water. How do we know Ebola isn't spreading by way of contaminated water in West Africa? Even if there aren't cases linked to water transmission, we have some that don't have a known transmission vector, including those who turn up as a nameless corpse in the streets. What sort of evidence would we expect if Ebola was transmitting through a water contamination vector?
Right.
Well, first of all, there's no risk factors associated with water. If the virus were transmitting through a water-contaminated vector, we'd have a lot more cases that were clearly attributable to that.
Yep.
Secondly, the virus is enveloped, so it's not going to survive very well in water. And those people that turn up as nameless corpses in the street that we don't know where they got the virus, I would like to think of those as people who maybe had been caring for a diseased loved one or friend and had nobody left to care for them.
Right.
So there's lots of ways that they could have gotten it by direct contact that we just can't document at this point.
Right.
There's a good CDC page, which we'll link to in a bit, which summarizes all the human-to-human transmission that we know about from previous outbreaks. And it would just show up as a risk factor, and it absolutely does not.
So, Dave, if you want to see a disease that does spread by water, you should check out the epidemiology of cholera.
Yes.
Which is totally different in terms of the way it spreads through a population.
Alan, can you take the next one?
Sure. Bill says there's been much political blather over how asymptomatic individuals entering the country from West Africa should be handled. Surely science-based criteria and people of good faith can make sensible policies in spite of the politicians. We need to honor people like the folks at Emory canceling their vacations to care for other heroes and make their sacrifices palatable as possible. Yeah. So if it weren't the politicians making the policy, if it were the scientists making the policy, I think we wouldn't have this problem.
He mentioned something about approaching closer than 3 feet, especially in Maine.
Yes.
Yeah, so we have just talked before about our belief that, during the quarantine, you don't need to be during the incubation period. You don't have to be quarantined.
Well, the CDC guidelines, which were were either just released or just revised, that we linked to at the beginning of the show, those actually do specify. They recommend that people with certain types of possible exposures stay at least 3 feet from other individuals in public settings and not take public transportation or airlines. And I believe the nurse in Maine would fall into that category. But, very importantly, the CDC guidelines do not say that these people should be locked up.
Right.
There's
a big difference there.
They say, they should be at their homes. They can talk to their workplace and figure out, I think on the employer's basis, whether they're going to work. Other than that, they should not be riding a Greyhound bus or getting on an airliner. But that's that. Are we going to get to this CDC document, or have we gotten there?
We're
going
to
get to it because it's really good.
It is good. Dickson. I don't know if you can see Dickson. The bold parts are what you should read.
I got that.
Good, Dickson.
From looking at what happened last time. So Jeff writes, of course, healthcare workers involved in dealing with Ebola should wear PPEs, but these scientists, see link below, are reasoning, in quotes, they believe, in quotes, there is a real concern for Ebola spreading through the air.
All right, this is an article at CIDRAP that we talked about before. Highly speculative.
Yes.
There is no epidemiological evidence that this is airborne. And remember, airborne means longer distance spreading on small particles, not vomiting on someone, not sneezing in someone's face.
Right.
It is not airborne.
So, Jeff, if you want to see a disease that spreads airbornely and totally different in terms of its epidemiology, look at influenza. Thank you very much.
Yes, which you can see nowadays because it's getting to be the season. Yeah, this is the article from CIDRAP, which is where Mike Osterholm is, who we've referred to before.
We have.
And these folks are in the same camp of, let's whip up possible fears about what could go wrong, and gee, everybody ought to be in complete NASA spacesuits in order to come in contact with anyone in West Africa. And yeah, it's a very, very speculative paper that is just not useful, I don't think.
One of the times when we talked about it was on TWiV 304. We've talked about it other times as well. But check it out.
Rich, you're next.
Along the same lines, Lance writes, this is our friend Lance. This is...
he works for Tom, yeah.
Works for Tom, okay. Yep. Airborne transmission is an epidemiological concept. This is the phenomenon of an infection being spread from one individual to another without direct contact, so cases can occur without apparent exposure to another infected case. It's important to understand the epidemiologic observation comes first, then the mechanism of aerosol spread arises in order to explain the epidemiology, not the other way around.
Here.
Overwhelmingly, Ebola cases report contact with other Ebola cases.
Right.
So this has been said many times. So there we go.
So he says biology is never 100%, and that's because most of these connections are done by interviewing people. And if someone has died, you can't do that, so you interview people who knew them, and they could make mistakes.
Yep.
So it's not 100% perfect.
Right.
Well, and this things not being 100% and scientists being unwilling to make absolute statements is what winds up getting us all in trouble all the time, because that's where all the what if or how do you know things come from.
How do you know?
And, you do the best you can.
So there are some people who are going to be tired of the transmission stuff, but I understand you may get it, but there are a lot of people who like repetition. And it works for them to hear this over and over again. So bear with us.
Yeah.
Lance says he's hooked on every episode of This Week in Ebola Virus. All right, next one is from Stephen. A couple of questions. One, Ebola hemorrhagic fever. Is there evidence that Ebola virus is really transmitted by all bodily fluids? Or are those bodily fluids contaminated with blood or plasma containing the virus? As far as I can tell, it is a variety of body fluids, not just blood.
Right.
And it's been looked at, and there are papers out there that we've mentioned. I think one is coming up. 2, epidemiology. Even in the absence of risk factor questionnaire data, does the epidemiological picture of an outbreak of any disease provide evidence about whether disease is sexually transmitted, pet transmitted, water transmitted, etc.?
Yes.
And the evidence is that no, it's really not a sexually transmitted, pet transmitted, or water transmitted disease. There is the possibility of it being in semen, and that can lead to transmission, but that's not the way we think about this virus being transmitted.
But finding mechanisms of transmission is the origin of epidemiology.
Well, he does, but he says in the absence of risk factor data. So I don't know how you would
in the absence
right?
of questionnaire data.
Right.
So the does the epidemiological picture provide evidence about how it's transmitted? And I would say, go back to John Snow. He looked at a map.
Yeah.
Right. He mapped addresses of cholera cases and said, "Hey, they're clustering around a particular water pump."
Correct.
Right.
And
so that would
determined that it was a waterborne infection.
Yep.
So let's say John Snow was dealing with a sexually transmitted disease, right? He would not see clustering in that way.
Would not see geographic clustering.
Yeah.
You would have to trace contacts in that.
And he would possibly see that nuns didn't get the disease
Yeah.
and prostitutes did.
Yes.
Well, he would get clustering around a brothel.
Right.
You would get clustering, but in a
Well,
different
you'd have to-
place. You
you'd
wouldn't
have
be
to
around a
somehow-
water pump.
Yeah.
That was the quotation from Harold Zerhausen.
All right, number 3, more epi. Considering dogs in Africa, I don't think we're talking about coddled Shih Tzus in Fifth Avenue apartments. The dogs in question may be pets wandering the streets, if there are streets, or semi-feral. Again, wouldn't dogs as vectors jump out in the epidemiological evidence? Yeah, they would. And
Yeah, they would.
They don't. I mean, they seroconvert, so they're infected, but I don't think they're a risk factor.
No.
And
They may be infected. Serological evidence doesn't tell you that
yeah,
it's the
they
same
may be.
virus, but they may be infected.
But, there's one study where they tested dogs further and further away from an outbreak, and they became less
yes,
percent seropositive. So that's pretty...
it is pretty
Suggestive.
strong suggestive evidence.
Number 4, is anyone studying the sociology of comments on Ebola virus to TWiV? No, but someone should do a PhD thesis on it,
Absolutely.
Yes.
There's several PhDs in this.
because we don't filter them. We put them all up,
Yeah.
Right.
and that gets us in trouble sometimes. But you should. Someone can do it. You're welcome to the data, free of charge.
Indeed.
All right, brings us back to Kathy.
Jürgen writes, here's my question. You discuss a lot about the possibility of sexual transmission of Ebola, but I wonder how that could be proven considering that there is much simpler means, direct contact, and that non-cyber sexual intercourse would often include these. How likely would it be to find positive proof for an exclusively sexual transmission?
Oh, it's absolutely exclusively sexual is HIV, right? So you didn't get it by contact with patients. If they threw up on you, you didn't get it. But needle sticks, and they do histories, and they find out that this was this person's partner and so far. It's very clear when it's sexually transmitted,
Absolutely.
right?
Actually, HIV is a really great example for something that shows up
Sure.
epidemiologically as a sexually transmitted disease.
Yeah.
Alan,
think I'm next.
You're next, yeah.
Ross writes, I just had a thought whilst listening to the latest episode. One would think that investigating whether Ebola persists in semen after recovery would be a relatively simple study. And suggests, could one recommend that where possible, using an appropriate container, one should keep the condom after sex in a fridge until such time as researchers could come back and collect it. Is the infrastructure just too poor in West Africa to make this feasible? Is storing semen too dangerous? Does this study pose an unacceptable risk to researchers? Well, Ross, I think that would be a difficult study to do just about anywhere.
Yeah.
But particularly in Africa where people don't wear condoms.
Or have refrigerators.
Look, if this were,
strike two.
as we have just said, if this were a transmission, we'd pick it up epidemiologically.
It would be, yes, it would be very clear that this was the transmission route. You would be able to see it clustering around individuals, and it would show up in brothels. It would travel along roadways like HIV does in Africa. You would see all of the transmission characteristics of HIV if the sexual transmission was a major route. It's not.
Now, in this big outbreak, if it's looked at retrospectively, it may pop up. Who knows? But so far, there haven't been a lot of cases.
Funerals and hospitals. That's hardly.
And by the way, Kathy's getting a little annoyed at people's obsession with Ebola and semen.
Well, it's just, let's get beyond this. It's not transmitted this way.
People are obsessed, but that's it. Dickson, the next one is from Corona.
Okay, well, it's all in small.
Can you
highlighted, so I'll read the whole
Can
thing.
you Can you try and glance through it? You want me to do it for you, Dickson?
Well, please do. Go for it.
So Corinna loves the Ebola. Okay, she's got 3 things. One, semen.
Okay, I was going to do more than that, but go ahead.
So she gives a link to an article where there's an anecdotal story of someone who was tested negative for Ebola and then apparently infected his girlfriend. But Kathy has put some notes here which suggest that this is kind of an unreliable anecdote.
It's not substantiated.
Yeah.
The ProMed Mail makes it look like the MSF people report this, but in fact it's the first person article in the BBC story, and we don't have any validation of the sources for the story, so we don't know.
Okay. The next one is about Ebola conspiracy. Her husband is from Guinea-Bissau, a neighboring country that doesn't have Ebola, and he says that Ebola is a U.S. experiment put in West Africa, gone out of control. So it's not, because nobody could make this. This happens in nature, and laboratories cannot make this and put it there. And so it's just crazy to think of it. I mean,
I suggest Googling Powassan virus and Heartland virus. If you're concerned that the U.S. government is coming up with these, why would we be doing it to ourselves?
And Marburg, and et cetera, et cetera, et cetera.
Yeah, we do not make viruses.
No.
If anyone has suggested that we made a brand new virus that didn't exist before, this is completely fallacious, and we could spend a whole episode talking about that.
But we're not going to.
We're not going to do that. Finally, survivalists. What's this about, the survivalist? How to survive.
There's a website written by a survivalist about how to survive the hype of Ebola, and she's actually amused by
apparently
it's one of the saner stories out there.
Yeah,
apparently it's
Ebola by a survivalist.
It's actually really well done.
Yeah, it is.
So I guess you guys know there's a whole bunch of people out there who fill their house with food and get ready for the apocalypse and all this stuff.
And
right?
guns. Don't forget the guns.
Yeah. So I don't do that. I just am busy enough with this stuff that I don't have time for that. And anyway, thank you.
I'll take the next
Dickson,
one.
the next one is actually right up your alley.
Perfect.
Dave writes, would it not be a good idea to get Ebola survivors to nurse Ebola victims, as I assume they will have acquired immunity to the virus? Well, I actually suggested that some time ago. And I think it is a good idea. And it is being done. So that's the way this is going to play out, I think.
As long as the care you're talking about doesn't require skills, healthcare skills, unless they are healthcare workers who have recovered.
There are people already in Liberia at the epicenter for the outbreak training the survivors to take care of the current victims.
Yeah, and they're being trained for the types of positions that they're qualified for, and there is a huge need for people to empty bedpans and do the sorts of things that would be done by manual labor in an ordinary hospital setting.
That's right.
And you can train folks to do that.
So you know what they've done? They've actually set up these barriers, these transparent barriers, that you can actually talk to your loved one by cell phone. And you can see them, although you can't touch them. That's the only part of it you can't do. And the people have come to accept that fact, and that's how they're going to avoid getting infected.
All right, the next set of questions are about the incubation period, and
So-
the first one is Rich, right?
Sure. Adam writes, he's glad that the New York Times article, there's a New York Times article about a paper, this is an Ian Lipkin paper, right, about surveying rats in New York City for viruses.
Right.
Especially glad that New York Times article on the paper starts off connecting these findings with the current Ebola epidemic, highlighting the direct importance of research to the public's well-being. So he was entertained by that article, and these, your rats in New York City are just loaded with
I think
viruses.
at some point we should
not
do
Ebola.
this. We should do this paper at some point. It's interesting.
Right, it is interesting. Later on, he says, the CDC has stated that patients are not contagious before the onset of symptoms, but what data are consistent? What data are this statement based on? Once again, epidemiologic data. Okay, people have a lot of contact with people who are asymptomatic, and there's no epidemiologic evidence for transmission to those people.
Right.
And there's lots of data out there for that.
Right.
And here Kathy put in the link to this wonderful human transmission page at CDC, which summarizes a lot of the previous outbreak studies and tells you why. The main risk factors do not include contact with someone during a period before they get Ebola. I wanted to mention. All right, let's finish talking about the epi, and then remind me to mention what I want to mention. Okay.
Yes.
I might forget. So, Kathy, you had found this great human-human transmission page. Right?
This is very cool. I'm just looking at this.
Yeah.
Very good.
And I like this quote. So basically, there's not a lot of virus in the blood just before the onset of symptoms. And they have a figure from a paper by Towner et al. That we talked about before, where they look at virus in the blood of people who they know are infected at a certain time, and they can do this kind of experiment. So the virus levels are quite low, and then they go up substantially when the symptoms begin. And that, coupled with the fact that there's simply no, you can account for almost all the transmissions by direct contact, is why we know this period is most likely a non-contagious period.
Yep.
Mm-hmm.
I heard last week, so we had a couple of symposia here in honor of Jonas Salk, because he went to college and medical school here. And on one of the mornings, Chuck Schumer was, I think, on TV at NYU or nearby. And he was talking about this happened because the NIH budget was cut, and if we keep cutting science, we're going to be in trouble. He was saying everything right that I would expect, except he's a politician wanting to be reelected, right? I wish I would know that he were sincere, because he's absolutely right that the terrible NIH budget does lead to problems in making advances.
Frank
right?
Collins said the same thing, but Tony Fauci took him to.
Well,
task.
Francis Collins said we would have an Ebola vaccine now, except for the NIH cuts, and that's a bit. Schumer just said we need basic research to be ready, and that's the better thing. That's what Collins should have said. Right?
That's right.
Mm-hmm. All right. Next up is Vincent. Where's Vincent?
I don't know.
Oh.
He's over here.
Gemma writes, so they say Ebola is only contagious when the patient is very sick because the fluids are full of virus. Does it mean that if you get just a few viruses, your body can kill them, so the virus is not that strong? And if you get a lot, your body could still kill them, but they reproduce so quickly that you just can't keep up. I think we don't know the answer, but it seems likely that if you get a big load of virus initially, it's probably going to multiply more quickly to higher levels, and we know that is correlated with symptomatology, and that maybe when you get a lower virus load initially or inoculum, you have a better chance of recovering. It could be, but again, these are hard to do in people.
One of those Towner papers does have some kind of evidence that, yes, people who get a lower dose of virus are more likely to recover or have a lower dose throughout the course of their disease. And that fits with a lot of animal data that we have, infections with virus, where the time to death or the time to disease is dose dependent.
Right. So there's the severity issue and there's the transmission issue.
Precisely.
The severity does, as Kathy just explained, it appears to correlate to some extent with the initial size of the inoculum. The transmission is a separate issue.
Mm-hmm.
People aren't contagious before they're symptomatic. And as Vincent said, we don't know exactly why that is. We do know that's the case from the evidence just cited. My theory on that would be that until you're developing symptoms, you may just not have enough virus in you to get any of it to anybody else.
Right.
It's a good question and a good discussion, because all of these things are numbers games.
Yes.
None of this is black and white, and so it's a matter of how much virus is around and how much you get on and how much it takes to actually initiate an infection. And it's not; these are not sharp cutoffs, right?
Which is why when the CDC makes recommendations on things like this, what they do is they say, well, what's the range of what's been observed?
Right.
And now let's pick the outside ends of that and set safe margins around them and make our recommendations based on that.
Right.
Which is why they say when your fever's above, 100.3, then we're going to say, or 100.4, then you should contact us if you've had an exposure. And that cutoff is based on this large body of evidence that says that that's a point where you're starting to become a risk.
Gemma also says that she's asking us because, the CDC has told us so many things that turned out to be false. She doesn't believe them.
I don't think the CDC has said very many things that were false. I think
No.
the CDC underestimated the skill level of the Dallas hospital.
Yeah.
Right.
Beyond that, I don't know that they've told us things that were false.
They made one erroneous assumption that hospitals were actually following the recommendations.
Yes.
When Tom Frieden said any American hospital should be able to handle a case of Ebola, he was assuming that the hospitals had, implemented these protocols and trained people to follow them. And we now know that that was not done perhaps as robustly as it should have been in some places.
All right.
Yeah, I think CDC's done a great job.
Yeah, I think
And
they've
is
been
still
really
doing
on
a
top
great
of this,
job.
actually.
Hey, you notice Frieden's been pretty quiet the last 2 weeks?
Well, I'm sure he was told to be.
Yes. He's an outspoken guy. I mean, his confidence in his system, but he shouldn't have said that.
Well, he has the luxury of survivals. People
Yes.
have been surviving this
Yeah.
disease in this country, so he hasn't had to say anything. The data speaks for themselves.
All right, Kathy, you're next, and there's nothing bolded here, so I don't know. You have to
Oh,
paraphrase.
Oh,
This
Joe
is
writes.
This is such a good
This is a
letter. You
great
can
letter.
read.
Okay.
It's
All
a
right.
really good letter.
Lately, it seems like you should name your reband to Vinny and the TWiV Pinatas. I'm impressed with your patience in responding to email. This is a classic example of why risk communication is not for wimps. While you all have been showing extreme patience and politeness, I've been yelling at my iPod for some of these folks to grow the hell up and get out of their fantasy world. You've been demonstrating the clear difference between having a, and these are in capital letters, scientific discussion and a political argument. You raise the topic and discuss the data, all the data, and look for data that disagrees with your premise. The folks writing the argumentative emails are determined to get you to agree with their worldview. They propose an extreme idea, provide some small selected data set to support their theory, and demand everyone agree with them and their truth. My 20-plus years of dealing with the public on risk have convinced me that the 80-20 rule applies. 80% of the people want to have a discussion and learn what they can about an issue. 10% on each extreme end of the debate are determined that they already know the answer, and the rest of us are fools for not agreeing with their ideas. Unfortunately, the extremists are the noisy ones and shout down most folks who want to engage in the discussion. Right. The old saying, "In God we trust, all others bring data," applies here. This needs to be repeated to these folks until it sinks in. No argument that includes the phrase, "it could happen," is based on actual data. Similarly, an argument based on saying, "you can't prove it won't happen," or on compounding multiple failures of multiple systems to invent a worst-case scenario, is not actually useful in managing risks. A key concept in risk management is, past behavior is the best predictor of future performance.
Bingo.
Yes, you can invent crazy scenarios and demand everyone prepare for the worst. Those of us trying to manage preparedness have limited time, money, staff, resources, information, and patience. Basing our decisions on something other than all the data available is a waste and is grossly unprofessional. Perception is not reality. Reality is reality. Perceptions are still important. Today, we learned that a second healthcare worker in Dallas had been infected, so this is a while ago. I'm assuming that the first exposure was from an individual failure to follow correct PPE removal practices. None of what we have seen so far is clear evidence that the transmission threat has changed. It is much more likely that these exposures are a result of human error. If I were investigating this, I would first look for signs of increased workloads and decreased staffing in critical areas, just like all of us have experienced in our everyday lives. The first place to look is in their training logs. This is very sad and very human. Let me close by suggesting that Vinny should not look at saying someone is ignorant as being an insult. History teaches that recognition of a state of ignorance has preceded every great human discovery. Calling someone stupid is an insult. The difference between ignorance and stupidity is that ignorance is curable. Let's celebrate our ignorance and then set out to cure it by listening with an inquiring mind. During times of stress, I tell my emergency response team, don't forget to breathe, as a way to break the tunnel vision that we are all prone to get. As always, thanks for the great podcasts, and don't forget to breathe.
Except
Right.
Dickson.
Oh, well, thanks. Because I breathe in and out anyway.
But
and you
his
can-
comment on ignorance and stupidity reminded me of an old joke from when I lived in Maryland. You know what separates ignorance from stupidity, right?
What, Alan?
The Potomac River.
Oh my gosh! But
This is great. I want to point out his wonderful statement. compounding multiple failures of multiple systems to invent a worst-case scenario is not actually useful in managing risks.
Oh, that's great.
I just want to point out, this is what Cambridge Working Group has done to invent this compounded failure scenario, which is why a lab-created virus is going to cause an apocalypse. This is just not useful in managing risk. And I do hope that calmer minds will prevail.
There is a useful concept in managing risk that's based on kind of the opposite of this. It's called the Swiss cheese model.
And
which is that any system is prone to failure. There are particular types of failures that can occur in any type of system. So you can imagine that the failure modes of a system are like the holes in a slice of Swiss cheese. So what you do is you stack up multiple systems so that the holes do not align. So if you have different systems that would fail in different ways in your Swiss cheese model, you can ensure that it becomes exceedingly unlikely for a cascade of failures to go through all of them, because they would have different modes in which they're weak. So that's kind of the opposite of constructing the worst case scenario, is using the Swiss cheese model.
All right, Alan, you are next.
Okay. Brooke, the subject line of her email deserves some comment. The subject line was, "A new plant virus." No, I'm kidding. This is yet another email about the Ebola virus situation.
Got you to look. Got you to look.
Yes. Skipping wonderful introduction here. Just go straight to the core of it. When the Ebola virus epidemic began in Africa, and I was asked by friends and family about how worried they should be about it, I responded that the healthcare facilities and equipment safeguards here in the U.S. could contain and prevent the spread of the virus, and that as long as no one is exhibiting symptoms of Ebola virus disease gets any bodily fluids on them, they're in no danger whatsoever. Then this whole sequence of events occurred, and she goes through the whole sequence of events, the Liberian patient going to Texas, and then the nurses, 2 nurses in Dallas, and so on, and then says, "So honestly, at this point, I'm ready to just throw my hands up in frustration and yell WTF at the authorities that be, because how are people supposed to believe us when there's so much ineptitude and discord from all those who are meant to be giving us assurance and guidance? How do all of you suggest dealing with this? How can anyone providing evidence-based knowledge on the situation be believed right now when the officials on the situation can't seem to get their own act together?" Right. Sigh.
Well, we have kind of discussed that to some extent, and that is that clearly in Dallas there were mistakes made.
Mistakes were made.
Underestimation of the training and capabilities and so on. But the evidence about how the virus is spread, and that people in the same household, the wife of, or fiance of Duncan didn't get sick, other situations like that, that data is starting to show everybody that it's not as much of a problem as we think it is when it's dealt with correctly.
Yeah. People make mistakes, and it happens. The Challenger blew up, right?
Right.
Stuff happens. It's not a perfect world. Okay, we do the best we can. And what's really important is for the people involved with all this is to be able to say, "Oh, we made a mistake. We blew it. Sorry, we'll do better next time." I wish the politicians would do that.
In China, the SARS epidemic went on for some time because they didn't say that.
Mm-hmm.
Well, and
that's the consequence of not admitting the truth.
There's a check against people being transparent with this sort of thing in this country because you'll get sued. So the reason we haven't had anybody come out and say, "Well, we screwed up," is because they don't want to be the target of all that.
Look, if you do that in China, Alan, they execute you.
You get executed, yes. So when you shoot messengers, you don't get the news.
No.
And she concludes, I'll just read the last bit of the letter. "Thank you so much for all the education, information, and amusement you've provided during my commutes. I still giggle when I hear stump grinding being brought up, and I can't hear Dr. Racaniello's introduction without thinking black and yellow. Finally, I miss hearing Dr. Condit's perspective these last few podcasts. I look forward to when he rejoins the crew."
There you go.
Isn't that nice? Thank you.
You and I met Brooke in Boston, remember, Alan?
Yes.
She came up at ASM
That's right. That was a part of the introduction to this letter.
Yep. So read it. Go to the show notes and read the letter.
Okay.
No,
I feel
not you. I'm talking about the listeners. Sorry.
Listeners.
Oh, the listeners. Yeah.
No. I think listeners should read it because it's really nice.
And she's got a pick in here, right? Is that going to...
Yeah, which we gave last week, 2 weeks ago, right, Kathy?
Yes.
Yes.
Cool jewelry from Etsy.
Very
on
cool
Etsy.
jewelry. Yes.
All right. Now, Dixon.
Yes.
You have to
All
talk
right.
into the mic. You're off mic.
No, I'm
This
on
next one from Marion, we have bolded some things that you should...
I will read the bold.
Okay.
things.
Thank you.
Marion writes, I have an idea that may help stop the international spread of Ebola virus. There is a gap in time between the moment of human exposure to the virus and the appearance of symptoms. I suggest indirect testing for virus growth before symptoms appear. Something called type 1 interferons are among the first proteins induced as a part of the innate immune response in the beginning of the virus infection. There are many other proteins called pro-inflammatory cytokines, chemokines, etc., that could also be important in this regard. Many of these tests are already commercially available. She gives an example of C-reactive protein. I suggest making these tests available on an investigative, situational, off-label, and provisional basis. Such a test could be part of a panel of tests, which now includes country of origin and temperature before entry or departure at international airports. Even if the tests are not FDA approved for clinical human treatment, it might be useful as a preliminary airport screening. Before objections are raised about cost and practicality, this is a simple idea, and if it works, could go far towards mitigating the unbridled, unsubstantiated frenzy surrounding an already difficult situation. It is probably relatively inexpensive, considering the costs that are either current or anticipated. It probably could be adapted very easily to a rapid pin-prick finger blood test. That's the end.
Okay.
It's a good idea, but thinking back to my own experience in trying to get an online diagnostic test for a disease that pigs sometimes catch, and listening to the government scream about the expense of such a test would be, I think I could hear the same arguments here again. So even though we know what to do, sometimes you may not be able to afford to do it. And this may be one of those instances.
I don't think it's specific enough. I think you're going to pick up...
you will pick up a lot of diseases.
Even if you could do it, I think it's
Sure.
too non-specific. You're going to pick up too much stuff.
You might pick up all the flu victims, too.
Yeah, exactly.
And,
Flu-like illness. Yeah.
Pro-inflammatory cytokines and these other markers spike and drop for all kinds of reasons.
Yeah, that's
and by the time you crank the sensitivity of the test up high enough to detect subclinical Ebola, because the goal here would be to detect it before the onset of fever.
Exactly.
When we're talking about, your body hasn't really responded to it yet, so by definition, you're detecting levels of cytokine elevation that are really, really small, and by the time you get the test that sensitive, the noise is going to be so huge, you'd end up quarantining everybody.
You got it.
Rich, you're next.
Okay. Let's see here.
Walter.
Walter writes, hello, TWiV Masters from a soggy late night in Northfield, Massachusetts, where it is currently 71 Fahrenheit, 22 C, and windless. Please comment on the Liberian Firestone Plantation's response to Ebola. If you have not already done so, please tell me which podcast episode it was in. Well, Vincent blogged on this.
Yes.
And this is a great story.
This is excellent.
This was an MMWR article, right? Is that right?
Yeah, that's right. They had a good article about it, right?
And this is the Firestone rubber plantation.
Yep.
In Liberia that has several hundred employees.
8,000.
Excuse me, 8,000.
Yeah.
Okay, and they had some isolated cases of Ebola, first of all, initially, and they responded in just an amazing fashion.
Textbook
and set
fashion.
up appropriate sites and precautions and procedures, etc., and contained it in a fashion that kept the incidence of Ebola in their purview much lower than the surrounding areas. And it's a fascinating read. It's really good.
But bear in mind, this is an enormous company whose whole business was riding on this.
Oh, yeah. And
Because
they have the resources.
If Firestone doesn't have rubber, they're they're out of work.
Right.
This was a huge deal for them. They took it very seriously, and they did it upright because they could. And it is a great example.
And I'd like to say that it seems to me that this is the way that the other outbreaks in the past were managed, by setting up this kind of surveillance and so forth, and that this particular one, for a variety of reasons, got away from us.
Well, this particular company has a rich history of accepting medical students from Columbia University in their fourth-year medical elective in the tropics, dating back to as early as the late 1960s.
Yeah, it sounds to me like they start off with a very robust health system.
It's a great training center. It's a great place to go and look at tropical diseases in a controlled setting. And one of their biggest epidemics, of course, is malaria every year. So they're quite used to these things occurring. So they have the proper facilities and proper medical care people as well.
So really, in a sense, the rubber plantation is almost like a different country.
Yeah, correct.
Yeah, am I correct that it's also reasonably rural?
Yes,
that's
correct.
Okay,
that's right.
Because I think one of the big problems with the current outbreak is that it got into busy urban centers. And that makes
it could have been stopped before it got into the city, but it wasn't.
Right.
Yeah.
All right, we need to step this up.
Okay.
Next one is Martin. Martin doesn't believe in Ebola virus. He says it doesn't exist. It's mostly panic. And he quotes me as saying, anyone can do PCR. You have to find virus. Well, when you're discovering a new virus, you really need to isolate the virus. But here we have a known clinical entity with very characteristic symptoms. So PCR is sufficient to confirm the diagnosis. There is no doubt that there is an outbreak of Ebola virus disease in Western Africa. And I just don't think that it's worthwhile, Martin, to bring this up. It doesn't help.
If I'm not mistaken, you can even do plaque assays with this thing, right?
Yes.
Yes. Although, I was reading a paper about that. There was the Towner paper that we mentioned, Rich, and they said plaque assays are not reliable to detect infectious virus. They use PCR. You need to talk to them.
And I meet more and more people who do TCID50s instead of plaque assays. I can't believe it.
Gosh.
What they're missing.
Kathy, you're next.
Okay, so this is Teresa.
Yeah, that's fine.
Does HIV infection increase susceptibility to Ebola infection? Does it change the mortality rates?
I couldn't find anything on co-infections. I looked in PubMed extensively. You think it might? You would think it might, right? Because HIV is immunosuppressive and it may raise your susceptibility, but I don't think it's been looked at.
It's a great question, though.
Yeah, very cool.
I would certainly expect it to increase the mortality rate, if nothing else.
Alan, you're next.
This is from Sophie,
who is a simple clinician.
Who is a simple clinician, yes. It gives another wonderful introduction. And again, we apologize, we're abbreviating all these, but there are so many.
The best part, Alan.
Right before the bolded.
Right before the bolded.
Oh, the weather sucks here, as always. Heavy rain.
She's from Copenhagen.
Right, Copenhagen.
Yeah.
I only want to make a humble comment, and I'm sure you already know this. In the previous podcast, the medical anthropologist from the American Museum of Natural History wondered why there hadn't been more emphasis on the hemorrhagic symptoms of Ebola. Early on in the current epidemic, there was an article published in the New England Journal of Medicine where the authors discussed whether it should be emphasized through the communication with the public that hemorrhagic symptoms were not the predominant symptoms, and emphasizing the term Ebola hemorrhagic fever could lead to missing the diagnosis of Ebola, and gives a link to that paper. Then came the report about the first 9 months of the outbreak, also published in the New England Journal, where the sample size was bigger. Here the authors documented that, quote, specific hemorrhagic symptoms were rarely reported in less than 1% to 5.7% of patients. Unexplained bleeding, however, was reported in 18% of cases. Unexplained bleeding was reported in 20.2% of cases who died and 11.7% of cases who recovered. That's that may have helped in tamping down some of the hype around that came out of, I guess, originally the hot zone, which had all these graphic descriptions about
I think so.
bleeding.
I think so.
Really kind
it's a good article. It's a good summary of what's gone on so far. This article,
Yeah, it has a nice table of clinical symptoms and their frequency.
Yeah.
Did you get through these comments to the next bolded bit, Alan?
Oh, yes. The next bolded bit Maybe the fact that specific hemorrhagic symptoms are not that common is a reason why these symptoms have not been emphasized more during the current outbreak.
Absolutely.
Yeah, I think so. Yep.
Yeah, I think so. And P.S. Do you ever consider making your apps for Android phones?
What apps?
Yeah, I don't have an app.
Yeah, it's a podcast. So
it's an iTunes podcast. You can just search podcast iTunes Android, and you'll find hits of how to listen to the podcast on your Android phone.
How about that?
Hey, Dickson,
Okay.
Stephen.
Stephen writes, Dear climatic virologists.
Climatic.
Well, the people who study climate. I thought I'd join the line of people looking for episodes not on Ebola, maybe even other episodes. I'm going to make that harder with a quick follow-up. My ears perked up when I heard the discussion about the possibility that simultaneous EVD outbreaks may be caused by environmental factors. I'd recently had a conversation where I and another listener wondered if you TWiVsters would manage to create, even briefly, this weather in Ebola virology, merging two of your major interests. But unless I wasn't listening carefully enough, you never named what those environmental factors might be. So, might weather be one of them?
So what I was talking about was the fact that the Ebola viruses have been found in bats, but they're not. So outbreaks are episodic. So the idea is that they're not always present in bats at high levels, and only a small percentage of any bat population is typically positive. So the idea is that maybe there are environmental factors that occur that allow the bats or cause the bats to become infected, make higher levels of virus, and that corresponds with outbreaks in humans. We don't know what those factors would be, but it would have something to do with the bat ecology, essentially.
Well, you could guess that the dry season versus the wet season, fruits or not fruits, migrating bats or not migrating bats, because they do migrate. So I wonder if that's been studied.
That reminds me of the hantavirus situation where there's a big bloom in the nuts that the mice eat, and so there's more mice, and so there's more hantavirus.
Right. So that hasn't been done here.
A ton of correlates at that level.
It's hard to do those studies.
Yep.
Rich, you're next.
Gretchen writes, while I have the utmost respect for your dedication to reading every email that you receive at TWiV, let me say that as a longtime listener, that in recent weeks, the show has become repetitive and boring because of it. Might I suggest an abbreviated version of follow-up for the duration of the Ebola panic? This would allow more time for you to discuss actual scientific papers instead of simply assuaging the fears of the populace. I know this email sounds rather critical, but I do really enjoy the show and simply look forward to getting back to what made me fall in love with it in the first place, science. Well, Gretchen, we just abbreviated your letter, and we're powering through this. Okay, so
we're working on it.
We're working on it. Hey, last week was not Ebola, but I don't know how you could be bored. Unless you know all this stuff, I'm not even bored preparing it. So, Gretchen, come on, we're gonna.
There are a lot of repetitive questions, but at this point, we're just touching very, very briefly on this.
I think this will probably burn out pretty soon.
I've gone from 10 to 5 emails a day.
All right.
Jesse writes, hello again, Grandmasters of TWiV. We're glad you liked our handle for you. These are the two French scientists who wrote us last time. Wanted to follow up, say that your responses were exactly what we were looking for and exactly why and how we proposed to study it. This is about sexual transmission. The truth is that not many people have looked in a controlled and rigorous way, even in animal models, and those that have only had small numbers, etc. The Marbury example is pretty clear-cut, which is why we mentioned it. Old and in German doesn't disqualify it. No, I didn't disqualify it. I just said it was just one.
It's another virus.
Right. It's another virus. Okay, so anyway, last but not least, PCR for detecting senses of nucleic acids. Why don't you just do deep sequencing? Yes, we have tried that. The problem is we did it once, and it's not conclusive, and I can't afford to do it again because it's really expensive. So it's not the ideal solution until prices drop further. This is trying to distinguish plus from minus strand RNAs in infected cells. PCR is problematic, and they're suggesting deep sequencing, which would really be great, but as I said, it's expensive, so we can't do it. Jesse and Carmen. Kathy, we're back to you.
Mary writes, has there been research that has focused on the number of Ebola virions for any of the current strains that are required to cause an infection?
All I know is that we don't know in people. Obviously, you can't do the experiment. In a mouse-adapted strain, one particle is enough to initiate infection. In non-human primates, 10. So if you keep going up the evolutionary ladder,
maybe 20.
I don't know how many people.
11.
I don't think
monkeys exaggerate, so maybe it's only one.
Mice lie and monkeys exaggerate.
Monkeys exaggerate.
Yeah. All right, Alan, you're down to Tom there.
Tom writes, my question or perhaps request is thus, would you consider recording a one-off special out of sequence with your current episodes? It might introduce some of the basics of virology to any new listeners who may not have a great understanding of the field. You certainly have a knack for talking about things in an educational, easy-to-grasp manner, and at no point do you ever seem condescending, so I feel that if anyone could help the layman understand how viruses replicate and exactly what makes them so fascinating, it's you guys. Very rarely do I ever get lost in what you say, and I'd consider myself only one step up from a layman, but there are a few people I know who are, and I'd like to point them to you. So we really should do a Virology 101 sometime.
Yeah, we should do a Virology 101 sometime.
Well,
we got a bunch of them already.
So yeah, Tom, they're on the web page
Yes,
at the
Tom.
top above TWiV. It says Virology 101. You click on those, and you'll see about 12 different episodes just about with the TWiV team talking about virology.
Yeah.
Then there are ways you can get to Vincent's lectures to his class at Columbia,
Right.
and he's also done Coursera.
And by the way, Tom, we're not laughing at you on this. This is something that has come up repeatedly, that we need to do more of those Virology 101s.
Yeah, Virology 101 gets you about halfway through the replication cycle, and then,
so
you get to Ebola, right?
It'll give you Virology 10 at this point.
Is that one or 99? Perhaps?
Yeah, well, we're up through translation, so
We are.
The next one I'm going to skip Dickson because Stephen is pointing out a paper in Lancet providing evidence for asymptomatic infection with Ebola. We have talked about that before,
Right.
so we don't need to go there. You're down to Lizzie Dickson.
Lizzie writes, every year for most of my life, my family has visited my relatives across the country for Christmas. This year, my parents told me that we might not go because they're worried about catching Ebola. I am a biology major, and I've been listening to TWiV for about a year, so I tried to use what I know to reassure them that it's perfectly safe to fly within the country. I don't think I was very convincing. What I could tell them to... What could I tell them to reassure them that we almost certainly won't get Ebola? By the way, your podcast has inspired me to learn more about virology, and I look forward to it every Sunday.
More Americans have been married to Kim Kardashian than have died of Ebola.
Correct. That still
I heard
might
it
not
Larry
do
King,
it.
but yeah.
That might not do it.
Lizzie, the chance of acquiring Ebola is so small. You should tell them it's so small they shouldn't even worry about it.
They should be much more worried about being hit by a meteor or a bolt of lightning.
They need to get their flu shots, right, Alan?
Get their flu shots and wear your seatbelts, because if you're traveling across country, whatever mode of transportation you're using is way, way riskier than Ebola.
And remember, mostly people who are dealing directly with Ebola-infected people get infected. So you're not going to do that.
So Lizzie must have a touch of the scientist in her, because she says, what could I tell them to reassure them that we almost certainly won't get Ebola?
Yep.
Right? So she's got the scientific mind state that won't say anything absolutely. What you have to tell them, Lizzie, is you are not going to get Ebola. Period.
Correct. I know viruses because I listen to TWiV, and they say that the chances are less than Kim Kardashian. No.
Yes.
Actually, I had an opportunity to talk on our local NPR station about this the other day, and
good.
when they, at the end of the interview, they said, "What would you like the public to know?"
Right.
And I said, "I would like the public to know that they are not going to get Ebola."
Exactly. Even if they listen to Fox News, right, Kathy?
Right.
The next one is from Stephen, who just brings us up to date on the state of filovirus sequences integrated into mammalian genomes. And I said bat, and I couldn't think of others, but he cites a paper. Bats, rodent shrews, tenrecs, and marsupials have integrated filovirus sequences. And he mentions our TWiV 303 on integrated bornavirus elements in the squirrel, where it's shown that those sequences can be protective against infection. So who knows if the Ebola sequences are protective as well. Why don't you ask Linfa Wang? He said that I did. He said, I don't know.
Okay, good.
The experiment has to be done.
Aha.
All right, Kathy.
Gail writes, in veterinary medicine, we have been fortunate to have access to live canary pox vectored recombinant vaccines against feline leukemia virus and rabies virus for several years. This technology has proven both extremely safe and extremely effective.
By the way, this is in regard to a discussion of recombinant vaccines.
Right.
In TWiV 307, yes. In the case of a feline leukemia virus vaccine, it took us from 90% protection in prior vaccines to 99% protective, which probably meant saving the lives of countless thousands of cats because we really appear to have broken community herd transmission in a lot of areas now.
Nice.
These days, it is truly rare for me to see a feline leukemia virus positive cat, and it is virtually always in a 100% outdoor or overtly feral cat.
Right.
So it's great to hear from Gail, who's a veterinarian in California.
Right.
I had a cat that died of feline leukemia. It was a tragedy. He was the best cat I ever had.
Yeah.
Stupid was his name.
I like this.
He was a wonderful cat.
Hey,
What a tragedy.
I came there and you were calling your cat stupid. Was that the cat?
No, that's not the cat. This
But you
was a
call all
lox.
your cats stupid.
That's just the cat.
Dear.
Yeah, too bad they're not just ignorant cats. That would mean that you could
That's right.
enlighten them.
That's right.
Exactly.
So
Exactly.
I just want to point out that this is really great because, you know, the veterinary practice is a wonderful place to vet concepts like recombinant vaccines. And they've had enormous success in veterinary practice, as is pointed out here.
Yep. We are up to Alan.
This is me now. Caroline asks, and this is the entirety of her note, does infection with the resistant Ebola virus give immunity to the Zaire Ebola virus? And the entirety of the answer is no.
Oh, that's right.
Yeah, the individual different Ebola viruses do not cross-protect.
Right.
And Vincent
Unfortunately.
has a blog post about that.
Yes.
Which I did in response to Caroline because I thought it was a cool question to answer.
Right.
Dixon,
Yes.
Beth.
Beth writes, I took the opportunity this morning to get up on my Ebola soapbox and do some science communication in an unusual venue, a church service. The pastor was discussing Ebola in her sermon, and at the end of the service, I decided to get up and do a PSA, public service announcement for the congregation, to dispel some of the myths being perpetuated by the media. I hope you don't mind, but I borrowed and properly cited a bunch of information from your podcasts, focusing mainly on two ideas. One, that Ebola virus is not, nor will become, airborne, and two, that the Ebola virus outbreak is a sociological issue much more than a virological one. I explained that as scientists, we are trained to never say never when it comes to predicting something like a virus changing its lifestyle, but that Ebola virus becoming airborne is about as likely as pigs flying, and by that point, they wouldn't be pigs anymore. I love this metaphor because not only do people find it funny, but I find it very clear and understandable, and an understandable way of communicating a point. Even though many members of the congregation are fairly well educated, so to some extent I was preaching to the choir in a very literal sense, given that my poor fellow choir members have been hearing me rant about this issue for several weeks now. Most people seemed genuinely receptive and happy to hear a virological rather than a media-based political perspective on Ebola. I was applauded after my comments, and several people came up to me afterwards saying something along the lines of, "That was exactly what I needed to hear." This gives me hope that many non-scientists really are thinking critically about this issue and that they are willing to listen to the science community about it rather than subscribe to popular hype. This brings me to the point of my email. I know that there are thousands of scientists and non-scientists out there listening to this podcast and getting the best information about Ebola straight from the crack team of Vincent and Company. Spread the word on truths about Ebola that the media is obfuscating. Tell your friends, tell your family, tell random strangers at the bus stop, and be good science communicators. Consider it your paycheck. No, consider it your payment back to the taxpayers for funding science research, or not, depending on how successful your last grant application was. In my experience, at least, people are often willing to listen.
That's great.
That's a marvelous
Lovely.
letter. Marvelous
Thank you,
letter.
Beth.
Indeed.
Rich.
Peter P.O., is that how you pronounce it?
Thanks.
We have a letter later.
Yeah, with a P, I think it's P.O.
Piot,
they say
I
the
think.
T, Piot, yeah.
They say the T. Piot. He's the discoverer of Ebola. Gave a nice talk about Ebola in Oxford's on the 16th of October that was recorded.
Nice.
And Ken gives a link to that recording in response to a question. He also said it was extremely unlikely that it could mutate to be transmitted as an aerosol. So, might be a good listener's pick.
Yep.
Well, we can put a link
I
into
think,
that.
Kathy had a bunch of Piot things last time, right, Kathy?
Mm-hmm.
Next one's from Ruth, who is one of our new listeners. Ruth is 69 and was a scene design and lighting major, Rich Condit.
Yeah, I caught that. Cool.
Okay, I wanted to...
Ruth, my daughter, is in the same business.
Yep. No, this is not your daughter. She's not 69, right?
No, my daughter is not 69.
He's telling Ruth
He's
this.
telling Ruth this. I thought he said Ruth, comma, my daughter. Sorry. My favorite hobby
Even
is...
Vincent misreads things every now and then.
Yeah, I never said I didn't, but I don't get hell for it. You do.
That's true. That's
My
true.
favorite hobby has been researching history of infectious diseases and the story of emerging infectious diseases. I've gotten serious enough, so I now follow the infectious diseases newsletter, which means I was following the current Ebola outbreak almost from its very beginning. I was delighted to discover the TWiV podcast sometime in late September. In one of the more recent podcasts, can't remember which one, you got annoyed by a comment or journalist, something novel, we got annoyed, on the mutating to an airborne virus topic, and you said something to the effect, if Ebola is going to mutate, what it's going to really want to do is figure out a way to keep the host infected longer. And I sat straight up and thought, Ebola thinks? Viruses think?
Very good.
And that really got me stewing over many new questions, which led me to discover your Columbia lectures on YouTube, which I started watching this weekend. Anyway, in Lecture 2, you were very clear that viruses do not think, and I am certainly relieved about that.
We do a lot of thinking about viruses, though.
Moral of the story, your podcast led me to your blog, which led me to your course on YouTube, which I'm sure will lead me to much more research, not only about virology, but also about the larger subject of the emergence and history of infectious diseases. Please keep up the good work.
love it.
And that's exactly what we would like to do, Ruth, get new people who follow the path
To poison.
to
Yes.
virology. And that
We
brings us...
sometimes anthropomorphize viruses, but
we do not want to do that.
viruses are not people, my friend.
No.
Kathy,
Nor are ferrets.
Stephen writes, I wanted to add a couple of points in the discussion of checking your facts. In medicine past, tremendous harm was done by various medical practitioners not checking their facts. I believe I've read that the airline industry's procedures made a huge difference. Create a checklist, check everything on that list every time. The Dallas Ebola case is a case in point. The physician, presumably an overworked ER physician, assumed he or she knew what the situation was and didn't have to ask again. And this is in regards to the first visit that Duncan made to the emergency room. I nominate a term for the act of checking your facts, even if it might be embarrassing. A Racaniello, as in, he just performed, did, or committed a Racaniello.
what about a black and yellow?
Yeah.
That sounds like a drink.
Yeah.
It does.
Yeah, it's too long, though. I appreciate the sentiment, but it's too long.
I'm putting a link in here because
Yeah.
I think I've got this right. It is to a New Yorker article on the checklist.
Oh, yes.
Yeah.
Okay, that's talks about the origin of
this,
the checklist. I think it's the right article.
What's his
Talks
name?
about the origin of the checklist and
the guy here,
talks about
Mukherjee,
how it
right?
ought to be applied to medicine, and it's outstanding. It's really
Atul
good
Gawande.
article.
Yeah.
Is that Gawande? That's right, yeah.
Here.
Alan, you're next.
Okay. So we're up to David, right?
Yep.
David is in Nicaragua. Says, I noticed you were trying to get the pronunciation of Piot's name right in the last episode. As I am of Belgian origin, I would suggest the correct pronunciation is Piot. Go light on the Y. He writes it out P-E-E-Y-O-T. I included a very short audio file for further reference as to how I think it would have to be. I found some footage today on the web of the 1976 discovery of Ebola. Although these are just short fragments, I think it gives a good feeling as to how the circumstances were, and probably still are, if I can take my own experience and visual memory of my time in Africa into account. And send some YouTube clips. So thank you, David.
YouTube clips are short; they're pretty cool.
He calls TWiV a spectacular educational effort. Just wanted to point that out.
Wow.
Dickson.
Simon writes, anyway, I am writing to share with you a few articles of interest from the past couple of days In light of so much of the sensationalist media coverage, I think Vox, a fairly new online media venture, have really gone out of their way to provide a more rational viewpoint. And he lists a whole bunch of websites and articles and things. I have thoroughly enjoyed Vincent and Alan's recent discussions of the merits of a flight ban. If anything, it proves that the podcasts are definitely not scripted, and that, like all good scientists, you sometimes have disagreements. I submit for your consideration the following article by Nate Sliver.
Silver. It should be silver.
It's Sliver
Yes.
as written, but I will correct that if you'd like me to. By Nate Silver, why an Ebola flight ban wouldn't work. And then there's the reference.
How do you know?
No, Nate said that, not me. I'm
Not
just
Dickson. It's
don't
okay.
kill the messenger. Finally, in the New Yorker, there was an article by your friend Richard Preston entitled "The Ebola Wars: How Genomics Research Can Help Contain the Outbreak." And then there's a lot more information on that. Earlier this year, I worked my way through Professor Racaniello's Virology Part 1 course. Whilst it was fascinating and I learned a huge amount, I often struggled with some basic cell biology concepts. My last formal bio course was about 15 years ago. Then I came across the Introduction to Biology, the Secret of Life course on edX, taught by Professor Lander, a superb lecturer, no doubt. What a fantastic course and what a great teacher. I highly recommend it to anyone who is keen to learn or brush up on some basic biochem, genetics, molecular biology, genomics, recombinant DNA, etc.
Good. That's great. That's a
Yeah.
good
I
thing.
haven't had a chance to look at it, but I was at a mouse genetics course, and Eric Lander was one of the lecturers, and
He's
I
amazing.
remember it
He's-
as being outstanding.
Yeah.
He's truly amazing.
We'll have to put that in with our 101 just for people who don't have the background. That's a great idea.
Yeah.
Rich, you're next.
Timothy writes, "Dear TWiVical people, listening to your very welcome coverage of the Ebola outbreak in West Africa, and in particular the modeling, it sounds like the critical benchmark is getting 70% of affected patients into beds and isolating them. However, I can find no news coverage of exactly where WHO, MSF, or other organizations are in this race, or how long it is likely to take to get there. Do you have any good sources of information on this? On an unrelated note, I would love to hear a TWiV 101 episode all about virus host coevolution. We'll get there. That's at the end of the, that's, yeah.
That's the ice cream on the top of the cone.
Endogenous retroviral DNA and all the latest on what it's doing in there. Cheers, and thanks for the best science podcast out there. So I don't have any data on how we're getting towards getting all those affected patients in beds. I don't,
That's
Do
like
you?
Nope.
9,000 beds they would need at this point.
If they have beds.
Don't
Yeah, and I
know.
don't think they're anywhere close.
I mean, one of the rumors that I heard from one of the reports on NPR was that the reason why it's spreading so fast is that the patients have to go home to get fed. They get up out of the hospital and go home and then come back. Because there's no commissary there. People have to bring food to the hospital.
And it's worth pointing out Tim's little thing afterwards. He says he signs himself as mentally at Gale Crater,
Yeah, right.
where the temp is minus 27 C and no rain for some time.
I'll bet.
0.25 inches of mercury pressure and sunny skies. Tell Rich to bring sunscreen. Gale Crater's on Mars.
Yeah, I figured. Minus 27.
Right.
Hey, Alan, you want to do your pick? It's time for you to go.
Yes, it is.
Alan!
Sorry.
We're
What
just
could
getting
be so
warmed up.
important?
It's Halloween, and I have to pick a child up from breakfast.
Understood.
So you do.
Yeah.
Understood.
I will be bad dad if I do not.
Yeah, you have to
Okay.
do it, for sure.
Cool. What's she going to be?
She's a cat.
All
Good.
right.
Excellent.
Did she get her feline leukemia virus vaccine?
She's had all her shots.
Good.
She's anything but stupid.
No, definitely not. So my pick is, we may have picked this before in past years, but anyway, it's timely, and it's something I wish people would pay more attention to instead of whatever that virus is that they're talking about all the time these days. This is the CDC's weekly map of influenza activity.
Oh, yeah.
And they do this each year. They update it every week throughout the flu season. They just started a little while back. This season officially started a little while back. And you can look at it, and this week you can see that we have local spread in a number of states, including mine, including Massachusetts, and down into
Including
Connecticut.
mine?
And
New
which
Hampshire,
strains
Florida.
are we talking
Yep.
about? What is the strain we're talking about?
It's all influenza.
It's all influenza, but you can drill down into their data. I think they start doing periodic reports in MMWR on which serotypes are prevalent in the current year.
Also on this page, there's another page where they do the serology, and you can figure that out.
Yeah,
Also,
so you can track all that from here.
Yeah, high levels relatively in Texas and Oregon at the moment.
Yes, and Alaska has regional
Even
spread.
higher, yeah.
Interesting.
It's not my fault. Not my fault. I got my shot.
Yeah, okay,
Yay.
so does
I
the
got
shot
mine.
match the strain? That's really what I was going with that question.
I did too.
Yeah, I think it may be a little early to tell if the predominant strain is going to match, but it's. I think the early indicators were that
Okay.
it looked good.
Alan Dove is at turbidplaque.com, also on Twitter. Thanks, Alan, for joining us.
Always a pleasure.
Hope you get
Bye,
a lot.
Alan. Happy Halloween.
Hey, Alan,
All right,
thanks for
thank
that
you.
treat.
All right, take care.
Bye. Have fun.
Hi.
Bye.
Okay, let's see where we were. I have to
Steven.
scroll. I have to scroll.
S. David writes.
And it's
my
me.
turn. I
No,
thought it was my turn. I
no,
went after
it's not your
Alan.
turn.
I thought I went after
You went after. You go before Rich. You already went.
All right.
S. David.
I want to go.
A few weeks back, lots of comments on NPR stories started flooding in, vacillating among reasonable inquiry, rumor promulgation, fox-like, and frank hysteria, re Ebola. For some time now, my compulsion has been to put in my 2 cents there. So anyway, a few weeks back, I posted a few comments suggesting that some journalists and some listeners could attain better understanding if they would check out TWiV podcasting.
Nice.
I wonder if some of your new listeners have flowed from that. Just taking a moment to brag, awaiting any actual facts.
Cool.
Thank you, David. It's hard to know where they're coming from, but we are seeing an increase in listeners. So thank you very much.
Right.
Kathy.
Justin writes. Is that the one I'm on?
No,
Mm-hmm.
Kyle.
Okay.
Oh, Justin. I'm sorry.
Yeah,
Justin
Okay.
Rose.
Skipped
Oh,
right
and he
over.
just gives a link to a lecture by Erica Ullman Sapphire at the NIH that was last November, November 6th. And it's a good lecture. I didn't get a chance to watch the whole thing, but she's got really nice graphics of the coat on the virus and then how that gets removed. And it's all really beautiful structural virology worth checking out.
And I think addresses, in part at least, the issue of how Ebola causes the disease that it causes, the pathogenesis, as related to the coat protein.
I was out in La Jolla last weekend, which is where Erica
San
Ullman
Diego.
Sapphire is. She's at Scripps, and I emailed her on the way in, and I said, "Hey, I'm going to be there. You want to do a TWiV?" And she said, "Yeah, but I'm in Texas."
Skype.
Too bad. And the funny thing was, I get in the cab to go to my hotel, and I hear an interview of her on a radio station.
That's funny.
And are you going to mention her crowdsourcing?
I'm going to have her on sometime, but yeah, she crowdsourced to get a piece of equipment for her laboratory, and,
Wow.
and it worked. And she raised the money and
Cool.
bought this piece of equipment. And so that's one of the things we'll talk about when we'll have her on. So she'll come back sometime.
Be done.
Dixon.
Now it's my turn. Kyle writes, we created a data-driven view of Ebola outbreak histories with data from CDC and WHO. Feel free to use it as an embed on your site or just as a research tool. Here's the link to the Ebola outbreaks database. It gives a nice link.
All right.
And that's well done.
It's nice.
And it's well done.
It's a nice site.
Rich, you have Dallas.
Dallas writes, with materials like fecal material and vomit, we have an organic matrix of material with very high chlorine demand that will neutralize bleach and protect virus particles. That's right. Dallas is writing about alternative procedures for getting rid of Ebola. This is the same mechanism to make biofilms very bleach resistant. So bleach is commonly what's used to get rid of Ebola. A virus that doesn't seem to survive drying well enough for airborne transmission could possibly be deactivated by desiccation. From the physical chemistry many of us all took decades ago, we can note that desiccation is primarily about the chemical activity of the water phase, not about whether it is a fluid or solid phase material. This means that salts, such as sodium chloride, saturated brine, which have a lower chemical activity of water and a huge osmotic pressure, may inactivate this non-airborne virus and could do so very rapidly in materials such as vomit or fecal material without any real chemical reaction. With your contacts in the virus community at BSL-4 facilities, if it hadn't already been done, you may get someone to test whether Ebola virus can survive in salt brine.
I don't know. It's a good question.
Unlike cholera organisms, which do very nicely like that.
Mm-hmm.
My guess is that despite the bleach neutralizing activities of some of these other things, bleach is still one of the cheapest and most effective ways of getting rid of almost any pathogen. But the salt brine, that's an interesting concept.
I will pass it on to our friends in the BSL-4s. I'll ask them, actually. I should have done that.
Ask,
Right.
Elke Mühlberger.
Yeah.
Next one's from Andres, who is from the University of Costa Rica, who's writing about bats and Ebola viruses. And he's talking about the evidence for fruit bat reservoirs of Ebola virus, which is quite good. Talks about the role of bats in emergence of other diseases. I would like to emphasize that killing bats has not been shown to be any good towards disease control, and it actually is detrimental in controlling the disease as well. Examples include Marburg and rabies. Bats already have a bad reputation, but they are important pieces of the ecosystem, being pollinators and seed dispensers.
Yep.
And insect eaters.
In defense of the
Indeed.
bats.
Indeed.
Yes. Kathy.
David writes, the CDC has been vilified for letting an Ebola-exposed nurse fly after she reported a mildly elevated temperature. Note, I didn't say fever. Fever is usually defined as a temperature outside the normal variation for humans, which is about plus or minus 2 degrees around the mean of 98.6 degrees Fahrenheit. So consider measuring body temperature in those who are exposed to Ebola as a screening test. If one sets the threshold for the screen low, then most Ebola cases will be discovered at the expense of an overwhelming number of false positives. Setting the bar too high will miss too many Ebola cases while avoiding the majority of false positives. The CDC chose a cutoff of 100.4 degrees Fahrenheit, which seems very reasonable to me in my practice as a pulmonary critical care doctor. This brings me back to the phrase, quote, low-grade fever. This seems to me like low-grade pregnancy, when a pregnancy test is above average, but within normal limits. It's a value-laden phrase that implies the desire for fever or pregnancy on the part of the speaker, but really translates as normal. The Ebola-infected nurse did not have a fever when she traveled. She later developed one and was diagnosed with Ebola. About 50% of her fellow travelers had a temperature above 98.6 degrees Fahrenheit, and none of them, so far as we are aware, went on to develop Ebola infection. Let's recognize the imperfect nature of this test and stop bashing the CDC for not quarantining the Ebola exposed with a temperature above average, which would be about 50% of healthcare workers, travelers, hospital staff, taxi drivers, etc. More if this measurement was made repeatedly. Best podcast ever, Dave.
Well done.
It's great. This is tremendous.
Yeah.
Mm-hmm.
It's a really good point.
Yep.
Dickson Despommier.
Paul writes, and he starts out by giving links for the legal authority for quarantine and isolation. And there are CDC links, and there are tables set aside for each state as to what their particular statutes are for that. And then says, as of this writing, 9 windless degrees and 68% humidity, the governor of New York has purported to impose a quarantine on health workers returning from helping, although it appears from the above reference chart, that is the province of the local board of health and health officer who were not consulted, and it gives a reference to a New York Times article. As this situation continues and people flail around for solutions, it is important to remember that isolation and quarantine constitute deprivation of fundamental constitutional rights. It is imprisonment, which requires more than an enabling statute, but genuine due process and equal protection. Similarly, the right to travel is a fundamental human right that must weigh in the balance in considering policy interventions.
Yeah.
And this then allows me to say that Christie, our governor of New Jersey, made some inflammatory and inappropriate statements regarding all of this when he overreacted to the inflammatory nature of Ebola outbreaks, and he has no biological basis for his statements, and really offended a lot of people.
I think
And what bothered me about that is that when he got bashed for it and was trying to back out, as is so typical in these cases, he never admitted that he did anything wrong, blamed other people, pointed fingers elsewhere. Drives me nuts.
Listen, I was a victim of that bridge event. And then, that we won't go on about that. This is not a political polemic, but a lot of people out there trying to play the role of the overseer, and they are exercising their privileges and powers beyond the scope of the problem.
Rich, you're next.
Juan writes, "Hi. I can see the merits of both arguments on whether or not to execute a flight ban from Ebola-affected countries. While this would contain the epidemic to a certain degree, we should remember that this is a social problem, and the problem with the ban is who will establish such a ban. I'm afraid that if the flight ban is established unilaterally by the West, people in those affected countries will see it as an imperialist action, remember polio in Nigeria, and therefore worsen the little cooperation with any other countries. If such a ban was to come into effect, it would have to come from those countries, which it seems unlikely." All right, good perspective on this.
I think the temperature scanning and the surveillance is probably good.
Yeah.
That solves all the problems here.
Yeah.
Does anybody have any reading on that patient in Spain, by the way? That's an older case, but it just occurred to me that they did have a patient.
I think she was released.
Yep.
I think she's recovered.
Okay.
Next one's from Kurt. "Hi, TWiV team. Our EMS agency provided Ebola gurney came in. Frankly, it seems like more trouble than it's worth, but it might work for transferring between hospitals. It gives people a sense of security, though, and that's got to be worth something." He sent a picture of this Ebola gurney, which is a typical gurney covered with a plastic shield with glove holes.
Yeah,
to work
it's an
with the
isolator,
papers.
basically.
It's basically a portable isolator, yeah.
That's right.
So that's cool. Thank you, Kurt. Kathy, you're next.
Charles writes, "The Atlantic has put up an article titled 21 Days, a Biological Warfare Expert's Warning Against False Comfort in Ebola Messaging." And Charles gives the link to that. I looked at the article in the Atlantic, and on the Atlantic page for that article, there's a link to a follow-up article, one line of it which I'll just quote: "The misinterpretations and misrepresentations of data that Hatfield espouses can be found in many places online, and especially on TV." So,
I just looked up the nurse in Spain. She recovered.
Dickson, can you skip to David, please?
I will. David writes, "Dear TWiV team, ever since I left for Africa in 2007, I was fascinated by Ebola because of its grotesque features. It is highly lethal, and frankly, of all viruses out there, I guess it would be the one that leads to the most gruesome death." I might or may not agree with that. If the virus would be so hard to transmit, how is it possible that patients in prepared hospitals in Spain and Dallas infect nurses?
Well, we've talked about that.
We have.
Probably an error in the disrobing.
That's correct. Or removing gloves. Yeah. The only explanation I can come up with is that the transmission estimates are based on the previous outbreaks that took place in small villages of 100 people where most got infected and the virus could not spread due to containment.
That's not true. They were larger, and there were some urban outbreaks as well.
Yeah, the picture that he gave, though, was of a smallpox victim.
I pasted that in.
Okay.
He said it was probably the most
right.
gruesome one, and I said, "Oh yeah, try this on for size."
Yeah, right.
So I suggest, David, respectfully, that you Google smallpox and look under the images. It's not nice.
Yeah.
So is the point here that the transmission is not what we think it is? I'm not seeing. He says, "I would like to hear your thoughts on this."
I think this is another sort of could be thing. How do you know could be?
Yeah. I think we've talked about that enough. Yeah. Next one's from Simon. "Hello, TWiVstadors." Nice. It's from Sweden. In episode 307, someone brought up the idea that one could browse through genomic sequence data in search of hosts for viruses, specifically about Ebola, if memory serves. And Alan responded by saying this would be too expensive because of the needle in a haystack scenario where you're looking for a relatively short sequence of a couple of KB and trillions upon trillions of data. Would this also be true of retroviruses? If they are the result of a retrotransposon gaining a few genes, this should imply that for every retrovirus there is a causal retrotransposon, if you will. And those tend to exist in quite large numbers in non-coding regions, their host genomes, and that should mean that you could add a couple of extra needles to Alan's needle in a haystack analogy. Mm-hmm. Would this be a proposition worthy of testing? Has this already been tested? Mm-hmm. What was the original problem? Can someone remind me that we're looking
I'm
for...
having trouble coming up with this, too.
We're looking for Ebola sequences and all the genomic data out there?
Guess.
Maybe so.
I don't, I'm not sure I agree with Alan. I don't think that's impossible. That's what people do.
That's what people do.
Right. But so he's saying look through, yes. So all the existing genome databases and look for Ebola sequences. So you could go to the UCSC genome browser and somehow set up a thing to do that. But so it's a data crunching thing. But you would probably find some of these sequences that we've already shown have been published to be found in mammalian genomes.
Yeah, I don't think it's an impossible task. I think bioinformaticians do this for a living,
right.
And they write clever algorithms to do it. I mean, it doesn't happen instantaneously, but they got nothing else to do, sitting in front of their computers, right?
Right. They could,
just kidding.
They could do one of those crowdsourcing things where everybody's little PC is, looking for SETI, for extraterrestrial, that kind of thing, same kind of thing.
Right.
Kathy, you're next.
Jacob writes, back in TWiV 301, your guest Curtis Suttle talked about the carbon turnover attributable to viruses in the oceans being about 150 gigatons per year. Gigaton is a measurement of explosive force of nuclear bombs, not mass. The correct unit should be petagram, 1 times 10 to the 15th grams, which is equivalent to 1 billion tons. I know y'all don't use our fancy metric system, but I see this one rather often, and it annoys me. Sorry, I'm a measurement scientist as well as a molecular biologist. Last weekend, I was walking past a group of teenagers waiting for food at a takeaway place. I didn't hear what the conversation was about, but one sentence caught my attention. And she was wearing like a full-on Ebola mask. I'm still not sure what they were actually talking about or what an Ebola mask would be specifically, but it was nice/strange to hear normal people talking casually about it. P.S. You should do an all-email episode at some stage.
Really? That's a great idea.
Yeah.
What's a full-on Ebola mask? It's just personal protective equament, right?
Might be
a full-on
Halloween
Ebola mask. Yeah, it might be a face shield and a mask. Who knows what they were talking about? But they're talking about it.
Well, Dickson,
yes,
we have reached the last email.
Oh my goodness, I get the last one. So Todd writes, "Greetings, masters of the TWiViverse. I recently learned via Orac at Respectful Insolence and Pepinge Van Erp at his blog that Homeopaths Without Borders has finally gotten some of their people into Liberia to help," in quotes. This has me a bit concerned. I was wondering if you might discuss a little bit about the potential for these individuals to become infected. Are they properly trained in PPE use? And more frighteningly, the likelihood of their carrying the disease back to their home countries. In particular, with homeopathy as popular as it is in India, does their involvement in Liberia mean that we will be seeing an outbreak of Ebola in India in the near future?
Well, I went to this article, and one of the things these individuals say is the companies working on the experimental vaccine should pack their bags because they think they're going to fix it all. I think this is the worst thing you could ever do is to let them in there, and I doubt that this is actually true. I would doubt that anyone with any medical competence would let homeopaths take care of those patients. Any thoughts on this?
Well, it may be that they go to places where there is nobody saying don't do that because there's no infrastructure. And they could find places where they're welcome with open arms. And it depends on how they view the infection. And, maybe they've read up on it and maybe they've taken it seriously. And
they don't believe in treating it, Dickson.
Yeah, treating it is one thing, but protecting yourself from getting infected is another thing.
Oh, well.
Do they plan to use PPE? Did they say in their article?
Didn't say.
Didn't say, right. Didn't say.
All right. We've gotten through our Ebola email.
How about that?
And
It took you, Rich, to help us get through it.
Is that it?
It did.
We will
It
have
did.
all the text of all of them on the website, as I said.
Right.
So enjoy. And let's do some picks of the week.
Yep.
Kathy, what do you have?
I picked something that my younger brother told me about. It's called Going Deep with David Rees. And these are things on the National Geographic Channel. And you can watch short little videos. He tells you how to do things that you already know how to do or think you know how to do. For instance, how to make an ice cube, how to
Right.
tie your shoes,
Right,
how to
right.
dig a hole.
How to boil
I
an
watched
egg.
one that's
right.
called Seriously, Trees Are Amazing. So you can watch the short little videos, and evidently there's also the full ones are available on Hulu for free, too. So I
nice.
think
It's a good show. I've
yeah.
seen the show. It's a good show.
Yeah.
Cool.
And there's some science behind it,
Yeah.
so that's
Yeah.
how I was able to use it as a pick of the week.
Right.
Rich Condit, what do you have?
I changed my pick at the last minute
saw
because a reader
Yep.
pointed it out to me, and I realized I really should do this. This is a shameless plug. There is newly out a special issue of Virology that is on giant viruses. I was an editor on this, but really most of the editing credit goes to Matthias Fischer, who really did all of the heavy lifting. And it was spawned by that conference that you went to in Germany, Vincent. We got a lot of contributors to contribute
Yeah, it's
articles,
great.
and it's great. So it's a nice compilation of articles on
about
giant
that?
viruses.
How about that?
So
And I think it's open access.
one of the emails referenced this, but we didn't read that part, right?
Right.
It was out.
That's correct.
Yeah, it's a good issue. Check it out.
Yep.
Dixon, what do you have?
Well, I have this year's winners in the Nikon Small World Contest.
Did you win,
Right.
Dixon?
I did not even enter. They are truly, truly amazing.
And these are so
Nice.
They're brilliant. And you know, this year's Nobel Prizes were given in chemistry for developing a new kind of microscope to look at subatomic almost. Not quite.
Not
but almost.
subatomic. Dixon.
I said almost.
Super resolution fluorescence
All-
spectroscopy.
Nanometer resolution on a light microscope. It's pretty cool.
Pretty darn good.
Yeah, very neat stuff.
Look at that picture.
That's gorgeous. I'm looking at one
Three cells, and you can see all the mitochondria.
fifth place. I'm looking at fifth place.
Fifth place.
Beautiful.
Oh, the page is just full of beautiful things.
They
Really
are.
nice.
It's a remarkable thing, and I have the honor of picking that this time. So I love that stuff.
All right, I have two picks. One of them is self-serving, so forgive me. But I did a podcast This Week in Microbiology last week in La Jolla at a meeting of the Southern California branch of ASM. And my two guests were tremendous. Laureen Mascola is chief of acute communicable diseases at the Los Angeles County Department of Public Health. And she talked about how they've gotten ready for Ebola. And then David Persing works for a company which has developed this amazing modular PCR technology, where you just, the whole thing with all the reactions and everything is in a cartridge that you slip into a machine, and you can diagnose almost anything.
Wow.
And he talked about how the U.S. Post Office uses these
Incredible.
to scan every piece of mail
anthrax.
for anthrax spores. It is so cool, and you got to listen because these guys are amazing. Okay.
Yeah.
My other pick, I just found today scanning my RSS feeds. This is a great article in the Times. Why Republicans keep telling everyone they're not scientists. Because they can know, every time they're asked about climate change, they say, well, we can't give an opinion. We're not scientists. Because they now know that you cannot refute climate change.
Right.
So they're becoming neutral.
How remarkable.
With a nice big picture of our governor, Rick Scott, here on the front.
He's not a scientist, apparently.
No, he's
I
not a
think the
scientist.
last group-
I can vouch for that.
The last group to finally admit this will be oil executives.
You know, they used to say it didn't. They used to have an opinion. They used to say it doesn't exist.
Of course.
And now they can't say that anymore because it's election time and it's quite clear. So that just bugged me. So I'm sorry. Oh, we have a couple listener picks. One is from Paul, who writes, he sends a link to a slide deck, which is called Tricks and Tools of the Great Scientists, the mystery of being a great scientist. Some professors, postdocs, PhD students are more successful at science than others, but why? So this is some ideas on that. That's really cool. Igor, who is our friend at the HIV Vaccine Enterprise here in the city. Hello, Vincent. It was great meeting you at the Salk Symposium. Here's the link to the quote-unquote podcast. You'd be hard-pressed to call it a podcast, since these are 3 to 4 hour episodes that come out every month or two, but they are excellent. The host is a fan of history, and he has the amazing ability to keep you engaged and interested for these long lectures on a variety of subjects. I got hooked on this and am now binge listening to all the past episodes, intermixing them, of course, with TWiV.
Wow, that looks cool.
So sometimes people complain we're too long. This is 3 to 4 hours. Apparently, he's not a historian. He's just a fan of history. But Igor told me the guy makes it fascinating. So your assignment, Dickson,
mine
is to listen to one and tell me what it's like.
For 3 hours. Okay.
I'm going to listen to them for sure. Because some of my commutes are 3 hours.
I'll give it a whirl.
And finally, let's see, one more. Amanda, greetings. All been listening to Twix for a while now. Love them. She's in Papua New Guinea.
Wow. Port Moresby? Is she in Port Moresby?
I don't know. Said some Institute of Viral Diseases, Environmental and Emerging Disease Units, Papua New Guinea Institute of Medical Research. Anyway, she sends a link to a short summary of the quote-unquote scary chemicals in vaccines and how they are not so scary after all when you do some basic math. An interactive map showing the damage anti-vaxxers have done. And finally, a story about why the minds of anti-vaxxers are so hard to change even in the face of facts or emotional appeal. So the links above, though seemingly powerful to those of us who support vaccines, may not be so helpful after all. But what else can we do but try?
Right.
The one particularly about the chemicals in vaccines I found interesting. She kind of relates, or the article relates, the amount of formaldehyde that's actually in our bodies naturally.
Yeah, it's great.
And how that compares to what's in a vaccine. And the amount in a vaccine is minuscule.
And this is something people are always, there are chemicals in vaccines. But
Chemicals!
No. There are chemicals in you. You are chemicals.
Thank you, Amanda. That's great. And it will do it for TWiV 309. And
amazing.
Don't
Just
forget.
amazing.
Yes.
That's not boring, guys. Come on. This is cool stuff.
I'm not bored.
No, we're not bored.
No.
I never get bored. I'm very proud of it. I always can find something to think about. Anyway, don't forget this week's sponsor of TWiV is the Department of Microbiology at Icahn School of Medicine at Mount Sinai here in New York City. An institution, that department in particular, has many, many virology labs in one building in the city, and they're looking for applicants for their PhD program. Go to their website, mssm.edu/MIC. And you other PhD programs out there, you should have sponsored TWiV as well, because they're going to get a big bump in applications. But you'll have to do that next year. But you can send me an email, twiv@twiv.tv, and inquire about sponsorships. I'd be happy to talk to you about it. Also, if you have questions or comments, send them to twiv@twiv.tv. Of course, you can find us at iTunes and at twiv.tv. Kathy Spindler is, Kathy Spindler is at the University of Michigan in Ann Arbor. Thank you, Kathy.
Thanks. This is a lot of fun.
Got through those email. Rich Condit is back. He's at the University of Florida in Gainesville. Thank you, Rich.
Sure enough. Always a good time. Great to be back.
Yep, very good to have you back. I guess that's it, huh? Dickson Despommier is right here at Columbia University. Thank you, Dickson.
You're welcome.
You can also be found at urbanag.ws and verticalfarm.com.
That's true.
How's that Urban Ag podcast going, Dickson?
It's going very well.
Good. I'm glad to hear it. Good luck. I do that with you. I forgot.
You do that with me. That's right.
Yeah, we have fun. The last two we spoke with people who are actually running urban farms, right, Dickson?
Exactly right.
It was pretty neat.
Not too far from where Kathy is, actually.
Oh, yeah, that place in Michigan off Route, what did he say, just off Route 1, was it?
30, I think it's off Route 30.
What was the name of that city? I can't remember, but yeah, they're in Michigan.
Right.
That was a cool place. I'm Vincent Racaniello. You can find me at virology.ws. You've been listening to This Week in Virology. Thanks for joining us. We'll be back next week. Another TWiV is viral.